Have you ever wondered about the threads of health that connect families, especially when it comes to something as serious as cancer? It is natural to look at family health history and ask, could this affect me? Knowing if colon cancer is genetic typically involves examining your family medical history for specific patterns and, often, undergoing genetic testing. While most colon cancers are sporadic, meaning they develop without a clear hereditary cause, a significant portion does have a genetic component, making family history a crucial indicator. The key distinction lies between sporadic, familial, and hereditary colon cancers. Sporadic cases arise from random mutations over time. Familial cases mean there is an increased risk due to a shared environment or inherited genes not linked to a specific syndrome. Hereditary colon cancers, on the other hand, are caused by specific, identifiable gene mutations passed down through generations. The two most common hereditary syndromes are Lynch syndrome and familial adenomatous polyposis, also known as FAP Lynch syndrome. For example, accounts for about 3% of all colon cancers and is linked to mutations in mismatch repair genes, significantly increasing a person's lifetime risk. FAP, while rarer, causes hundreds to thousands of polyps to grow in the colon, almost guaranteeing cancer development without intervention. Recognizing these patterns helps determine if a cancer has a strong genetic link. To figure out if colon cancer in your family might be genetic, start by gathering detailed information about your family's cancer history. This includes knowing who had cancer, what type it was, and at what age they were diagnosed. Pay close attention to family members diagnosed with colon cancer before age 50 or those who developed multiple cancers, particularly endometrial, ovarian, stomach, or small bowel cancers, as these can be signs of Lynch syndrome. Also, note if multiple generations on the same side of the family have had colon polyps or cancer. Share all this information with your doctor, who may then refer you to a genetic counselor. Genetic counselors are experts who can assess your risk, discuss potential genetic testing options, and help you understand the results. An insider detail to remember is the Amsterdam criteria and Bethesda guidelines, which are specific clinical checklists doctors and genetic counselors use to identify families at higher risk for Lynch syndrome. These criteria look for patterns like multiple close relatives with colon or related cancers, or early onset of these cancers. While complex, their existence highlights the systematic approach to identifying genetic risk. Also, advanced genetic testing now uses panel testing, checking for mutations in multiple genes simultaneously, offering a comprehensive assessment beyond single gene testing. Understanding whether colon cancer runs in your family due to genetic factors empowers you with crucial knowledge. This insight allows you and your healthcare team to create a personalized screening and prevention plan, potentially starting screenings earlier or more frequently than standard guidelines suggest. By actively investigating your family's health story and engaging with genetic experts, you can proactively manage your risks and safeguard your well-being for the future.